Hello, everybody. Welcome to GynZone. I am Katrina Jonas, and I'm the technical lady in GynZone, and I just wanted to give you a brief fly-in to our website and how to use it in your clinical life and training. By now, you will have received an invitation from your workplace. Please find the invitation email, click the blue button, and onboard yourself to our platform. Once you're in, I want to show you around a bit. Here we have the course overview. At the top, you find a topic selector. We have crossed the 1,000 videos on the platform threshold. So you might need this topic selector to find what you're looking for in a jiffy. The principle that we go through when we teach is a step-by-step approach. We start out showing principles and procedures with animations and illustrations to keep it simple and keep the level of complexity low. We then show you how to train with medical models. We're very big fans of training with models and not with women who just gave birth. Third step is we show you the procedures performed on actual patients. All videos with patients are filmed with patient and clinician consent. So they agree to this video being used for teaching purposes. At the top of the screen, when you're logged in, you have our search window that will search videos, courses, and your personal notes. It has what's technically known as fuzzy search. So if you misspell a word, the machine will still know what you're looking for and get you hopefully the right results. We have 2 quizzes on the platform. One about diagnosis of birth lacerations. It takes about an hour to complete. It covers anatomy, classification, and then it contains 10 clinical cases where you see a recording of a postpartum inspection, including rectal examination, and then you have to classify the tear. The other quiz is surgical skills, and it covers safe surgical practice, knot tying techniques, instrument handling, which suture to use for what kind of tissue, so on and so forth. It takes about an hour to complete as well. Both quizzes come with a certificate of completion that's saved to your personal profile. So in case you need to download it, you can always find it there. And it will also be logged in your local teaching doctor and teaching midwives team overview. So they will be able to see who have completed the quizzes on which dates. We have built an app to improve mobile access to our courses. Once you have activated your account on the platform, you can then go to Google Play or the Apple App Store, download the app and log in through there. It's nice for studying on your commute, recapping what did you see in the clinic today. It's nice for those last-minute brush-up courses when you need to perform a particular procedure. It makes for some nice micro-learning moments, low dose, high frequency. Regardless of whether you access the courses on the phone, in the app, or on your computer at home or at work, the platform will remember where you got to. So the next time you log in, it will pop up with a suggestion to continue where you left off. You can add favorites in case you need to collect some videos to show to a colleague, prep something for a course next week. If you click the little heart on the top right of the video, it will show up in your favorites list right on the home page when you log in. So it's easy to find next time around. You can add personal notes to each individual video. Right below the video player window, there's a note box where you can type in anything, observations, name of the colleague that you must remember to show this to. And your notes are personal, no one else can see them, but they are searchable. So if you look for Christina, because you need to show a particular video to Christina next time you meet her, the search function will help you find it. We have subtitles on the platform. You can toggle them on and off if you click the little CC icon in the player. They're useful for when you're watching video with no sound on, or if you find that the language needs a bit of support. The English material on the website comes with Swedish subtitles, which might be handy in case you're Swedish. You can always turn them off, of course, if you find that you'd rather see the perineum at the bottom of the picture. If you find that the videos are a bit too slow or too fast for your liking, you can adjust the pace by clicking the cogwheel icon in the player on the computer. And you can adjust it to anywhere from half pace up to double pace in sort of stepwise increments. The player will adjust for pitch, so the speaker will not sound like a smurf if you dial up the speed. It will get a bit clippy, but it's still completely audible. Viewer discretion marker. We've added a little icon on each individual video showing 1 to 3 drops of blood. 1 drop of blood signifies that it's what we call safe to watch on the bus. This might be knot tying technique, instrument handling, stitches on a foam pad, nothing that will alarm innocent bystanders. If there's 2 drops of blood, we're dealing with recognizable genitalia, but it might be medical models or illustrations. Enough so we think the person sitting next to you on the bus might think you're watching very strange things. With 3 drops of blood, we're dealing with clinical video and photos of actual patients, tissue, blood, all of the stuff. And we highly recommend that when viewing these videos, you sit watching a screen that's not accessible for non-clinicians. If you're in the break room at the hospital, please be mindful that patients cannot see your screen from the door. If you're watching from home, be mindful of homeschooling children, relatives. We don't want to traumatize any innocent non-clinicians. Also, the 3 drops of blood, they go red. It's easy to notice, and it makes it really easy to find the clinical video if that's what you're mainly interested in. Since the fall of 2020, we've done webinars. Almost every week, we have a new presentation. We have leading clinicians, researchers, inventors, interesting people coming online in a live session with half an hour for presentation of their subject of expertise, and then half an hour of Q&A with the participants. We have limited seats, so you have to sign up on our website, but it's free to attend for everyone who has a GynZone access. All of the webinars are recorded, so in case you miss out, you can always go back and watch it on our website. The recordings are usually online about a week after the live session. We will send out invitations to all GynZone users whenever we launch a fresh webinar program. So watch out for those in your email inbox. In case you need help, please do give us a call or send us an email. You're likely to get in touch with me, Katrina, or Sarah, our founder. And we're usually able to help you in quite short time. If you have any questions, please don't hesitate to get in touch. We're always happy to help out. Take care of yourself, your colleagues, your patients, and best of luck using GynZone onwards from here.